Okay, thank you. Welcome back. I am Nick Jeans. This is one of our final broadcasts from the floor of the Georgia World Congress Center, HIMSS 2010. I'm with John Gomez, Chief Technology and Strategy Officer for Eclipsys. Now, I'm sure a lot of our emergency medicine fans out there will know Eclipsys, but it's a emergency department best of breed vendor for electronic medical records, and they've got some exciting initiatives to discuss today at HIMSS.
So thank you, and I'll get a little closer.
Sure.
So thank you for having us.
It's social media. It's very very
It's
cozy.
very cozy. So so Eclipsys is doing a lot this week here at HIMSS. We've introduced some strategic relationships with Microsoft.
Yeah.
We've introduced our new Sunrise 5.5, which is the next generation of our product line. We're also introducing a platform called Helios, which is a very open platform, allowing third parties to innovate and develop applications on top of our products. So we're trying to very much embrace the concept of open, allowing ecosystems in healthcare to start driving innovation. And we're also introducing our mobility platform. So a lot going on.
So it sounds like this third-party platform is an opportunity. It sounds a lot like the App Store, and yet you've partnered with Microsoft. What's that all about?
So interestingly enough, when we started discussing about getting open, Microsoft was one of the first key companies that started saying, you know, we need to do something to kind of drive innovation in healthcare. And both of us have had a partnership for quite some time, and we decided it'd be a great opportunity to show that we want to not just talk about being open, but be open. And yeah, it's a lot like the Apple App Store, I guess, for healthcare would be a way to kind of pose it. Yeah.
Now, this is a separate venture from Microsoft. It's not related to their Health Vaults.
No, but our products are integrating with Health Vault, and we do integrate with their Amalga products. So we do have integration points, and part of that is using this new app, the new Helios platform and the API that we've created to allow that integration. But we are separate companies. So
every now and then I'll have a patient that really wants their records, and I have to tell them, oh, you're going to call medical records, and they'll make a CD for you of your images. Is this something potentially like a much faster, more streamlined way for patients to get their records?
Yeah, I think actually it is, and our mobility applications are going to be integrated with Health Vault on the iPhone. What's interesting though, we're also allowing for patient questionnaires. So the example I use is, you know, trying to create this ecosystem between the patient and the healthcare provider. So the patient questionnaires on the iPhone now, if you had an asthma attack, you could rate the severity on the iPhone. That immediately gets transmitted up to your care team wherever you are in the world, and it becomes really this kind of closed loop, healthcare kind of concept. But yeah, so there's much easier to get your information, much easier to provide information to those people that are trying to take care of you.
And for existing Eclipsys customers who are already used to the interface, is this going to be a substantial change for them, or are there going to be new features that they're going to have to get used to?
Yeah, it's actually a radical uplift in UI. We've been doing a lot to minimize clicks. The system actually, which we think is an industry first, learns from you. So if you've got medications you're always doing, procedures you're always doing, it actually begins to learn that those things are occurring and moves them up to the top of preference lists and things like that. Now, it's something you can turn off, but we're trying really, really hard to get the interface to adopt to the physician or the nurse versus you adopt to the UI, which you would think is a novel concept, but
no, that would be a breath of fresh air.
Yeah. So yeah, a lot of uplift in the UI.
Okay, and how you mentioned that even competitors and other third-party vendors would be able to put their own apps, their own modules into Eclipsys system. How can that be in your interest?
So, I mean, it's actually really interesting. We announced this on Monday here at the show. Since then, we've been approached by over 300 different vendors asking if they could build on top of the platform. For us, I mean, it does a couple things. One is, if we're going to really be open, then we need to be open, and we can't say, well, if you don't compete with us, you can be on the platform. But the other thing is, I think it also helps us improve our game. If we are going to be competing against people on our own platform, then we will really, really, really better do things really well, or it'll end up cannibalizing us. But we actually are pretty excited with the opportunity, and think we are able to stand up to the challenges of it. So.
All right, and I think we might have some buzz in our chat room. No? Okay, then we'll... Sorry, I thought I saw a signal there. Okay, I've got plenty more questions to ask anyway. If Eclipsys is like a best of breed and you're working to integrate with these third-party apps, Why is it that so many hospitals are kind of foregoing the best of breed approach to go to enterprise-wide solutions, and they're focusing more on interoperability with the wards, the dialysis unit, the ICU, and instead of just the most efficient unit?
Yeah, so we actually have started looking down that path in terms of, well, which way should we go? And the openness actually helps us because it provides flexibility and choice to the client, so to the hospital, but yet allows them to choose the best of breeds in each of their areas and tie them together. So, and the other thing, on the platform, we're actually talking about true integration of these apps, not just interfacing them the old-fashioned way through HL7. So it's a much, much tighter integration for us. It kind of gives our client base, at least, the choice, the ability to say, yeah, I want to either go single vendor, I want to go multi-vendor, best of breed or not, and the power of that choice is in their hands.
And how about some of these apps out there? Like, it sounds, I mean, if you've been approached by 300 vendors, it sounds like there's going to be a lot of development. We've had a lot of interest over the last few days in natural language processing, in like other architecture to help improve coding and billability, making charts easier to get reimbursement. Are these the kind of apps that people are talking about?
Yeah, I mean, we're doing a lot of that on our own, but yeah, we're actually seeing people that are thinking about doing things like, how do I integrate with Isabella and find a better way to do differential diagnosis that can lead to misdiagnosis, which, if you can find them, actually improve your return, right, on your revenue. So we're seeing a lot of the apps in that area. We are seeing some NLP stuff, but the breadth of apps that are potential apps that are represented by the vendors that have kind of approached us is across all the different spectrums of healthcare. So that's actually pretty exciting because it's a large matrix of apps and not just really focused in one area.
And the other big theme this year at HIMSS has been mobile applications. And do you offer solutions for providers, for patients?
So we actually have three. We've decided that we first would build everything ground up, not just adopt our desktop to a mobile device. So it's complete ground up development. We have a physician app, a nursing app, and a patient app. And we've broken it out into those constituents because we think that if you do that, you can devise applications that really meet the unique needs of each one of those constituents.
Okay. So you think like like me, a physician in an emergency department, I do have my best of breed vendor already that I have to interface with. I spend a lot of time in front of the computer, in front of the screen, and not so much time in front of the patient. If I had Eclipsys, if I had my iPhone, I'd be able to kind of maybe be at the bedside doing some charting, or would it just be like accessing images or
Actually, for us, we believe that for it to really be adopted and to be done well, you have to be able to not only see information such as allergies or images, but you also have to be able to transact place orders. So we've started doing things like saying, okay, what happened since the last encounter that I've done with this patient? Could be 5 minutes, could be 15 in an ED, but you really want this device to be part of your workflow and how you actually work at the bedside versus how we think you want to do it. So.
Okay. So you might be getting alerts, panic values, that kind of thing.
Yeah, exactly.
And I know this is a sensitive issue, but the iPad is coming, and there's been a lot of buzz and interest about that. Is there anything you can comment?
So I can tell you, as a company, we think it's an awesome device, and so I've predicted, or I've been speaking very publicly, I think over the next 3 to 5 years, we'll see desktops and laptops begin to move out of healthcare. Devices like iPad or iPhone or Android, we think we will start to see more of. The iPad, I think, creates some really cool opportunities for innovative companies to build on. We think we're an innovative company, so I'll leave it at that.
Do you have any numbers, anything that I could tell my hospital administrators about how like it might be worth it to sacrifice having the same vendor across all departments in terms of having Eclipsys or another best of breed vendor to actually be more efficient and save time?
Yes, I could tell you, some of the research we've done shows that most hospitals have between 200 to 300 different systems in their hospital. So even if you look at this as on a cost basis for reducing some of those apps, I think it becomes an interesting economic recovery, right, that you can kind of reduce down the complexity. But I do think that if you're not going to reduce all those apps down to a single vendor, at least look for your core products to be on a single vendor and hope that vendor can integrate and interoperate well with the others that you may not be able to replace either because they're dated or they're so loved by somebody that they're not willing to give them up. But I do think as you start to really create that core, you gain some really great benefits in terms of speed, efficiency, and return on investment.
Yeah. Anything online that for those people that aren't HIMSS?
Yeah, so if you go to eclipsys.com, we've got landing pages for the Helios platform, which is our open platform, our Sunrise Enterprise 5.5, which is our new release, and our mobility app. So everything is online and available for people.
Okay. Great stuff. This has been John Gomez for Eclipsys, Chief Technology Officer.
Thank you.
Thank you so much for coming.